In tonight's Health Check segment, Ballah speaks with a dietitian and gets some diabetes self-management tips and reminders for those impacted by this disease.
When you think of fruitcake, ham, Danish cookies and panchakrem, Christmas comes to mind, and along with it, the joy of the festivities. For many, it is the most wonderful time of the year, but often there are those who face health challenges as a result of overindulgence. Registered dietitian Misha Mohammed is urging everyone, especially those with diabetes, to be cautious.
Stick to a regular pattern of eating as much as possible. So try not to skip meals, try not to go long periods of time without eating. If it is you have a snack normally between breakfast and lunch, eat that at a normal time. So try to stick to the pattern of a normal day as well as the timing of a normal day. I would also say practicing portion control and having balanced meals as much as possible. So when we talk balanced meals, we want to have some starchy items there, or the foods from the staples food group. And along with that, on our plates, we want to be mindful of what is on our plate. So along with the starchy foods, we want to have some protein-rich foods, whether it be plant or animal protein. And along with that, we also want to have vegetables on that plate as well for the dietary fiber. So that combination at your meals will actually slow the release of the sugar into the bloodstream, and it will prevent the sugar from spiking after you eat.
It is easy to get caught up in the joy connected to this season. She stressed the importance of religiously taking your medication and shared her views on the consumption of alcohol.
So since we have to, liaise with the doctor, the dietitian, and so on, to be able to schedule taking your medications, and of course, if they want to have their drink or two, to be able to do that as well. So that would be up to the individual and, their healthcare teams. It's generally a risky thing, but it can be done in moderation.
The registered dietitian also advocates for regular testing.
It's always good to keep track and make sure that, okay, the blood sugar levels are reading well. And then based on that, you would know how to operate at Christmas. You would know, okay, if you can have a little bit of alcohol, if your sugar is controlled, you can maybe do certain things, you may have a little bit more leeway. Of course, not to go crazy, but again, just to maybe have a little more leeway.
Ms. Mohammed says some good old-fashioned self-restraint and moderation techniques could make the world of difference to your well-being during and after the Christmas season. I am Ballah with your TTT News Health Check.